Colonoscopies may not be the most comfortable thing to talk about, but it is really a vital part of protecting yourself from cancer. So we're going to help you prepare what to expect if you're going in with one. Dr. Stephen Armbruster is a gastroenterologist at LeBauer Gastroenterology. He's a member of the Cone Health Medical Group. Thank you for being with us. Let's talk about, first of all, who needs to be screened? Who needs a colonoscopy?
So for patients who have no symptoms and are in need of colon cancer screening, we start that at the latest at age 50. There are some patient populations where we screen earlier. For example, those with a strong family history of colon cancer will often start at age 40 or sometimes even younger, as well as African Americans. We start screening at age 45 as they're a little bit more likely to get colon cancer at a younger age.
So what can you expect? I mean, people just kind of cringe sometimes when you talk about getting a colonoscopy. Can you kind of walk us through the process?
Absolutely. So the worst part of the whole process for most patients is the day before the procedure. That's where we ask you to drink a bowel preparation, which is a volume of liquid laxative that we ask you to drink to help clean out your colon. It's the most important part of the whole process in terms of getting ready, because we like the colon as empty as possible so we can see with our camera, look and detect polyps and remove them. We ask you to drink that preparation the night before the procedure as well as the morning of. The other things that we ask you to do the day before the procedure is to stay on a mostly liquid diet. That also helps clean out the colon, but that's usually the worst part of the whole experience for the patient.
And then the day of, it's actually a pretty fast procedure.
It is. The procedure averages anywhere between 15 to 30 minutes depending on what we find and what we're doing. We often ask that you get to the office about an hour in advance. You'll have an IV placed into your arm so we can give you sedation to make you comfortable for the procedure, but the procedure itself is often the easiest part for the patient.
Why is this so important? How will it prevent you potentially from getting colon cancer?
So colon cancer is unfortunately too common. The average risk is about 5% in your lifetime for getting colon cancer, and the process takes a long time to develop. Colon cancer starts as small polyps in the colon, which we can easily see and identify and remove with colonoscopy. So colon cancer is one of the most preventable cancers in light of this test that's available.
Right, and it's becoming more and more prevalent, especially in younger people, and you may have it and not have any symptoms.
Exactly, and unfortunately colon cancer can often present without any symptoms at all. Too commonly we see a 50-year-old person come in with colon cancer and it's diagnosed on a screening exam. And so that's why this can be a silent disease, and that's very important to get screened for it.
So if you find yourself at that age or with any symptoms, do you call a gastroenterology office and just make that appointment, or do you go through your primary care?
You can do it both ways. You can call our office directly and we can help you get coordinated for that. Your primary care should also be talking to you about that regular in terms of planning for your next exam. But either way, we want to make access as easy as possible. You don't often need even an appointment with a provider. We can schedule things directly with our office staff.
It's an important test that could potentially save your life. So thank you so much for telling us about it. And you can learn more about colonoscopies and illness related to your digestive system online. Just go to conehealth.com/gastroenterology. There's also an online video for those suffering from irritable bowel syndrome. You can find that video at conehealth.com/wellness-on-demand.
House Call on Fox 8 is sponsored by Cone Health.